This is the Health Coverage Enrollment and Utilization Educational Series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai.
In 2020, California started implementing its own individual mandate. The logic behind this is that the more people who have health insurance, the lower the cost of health insurance for everyone. Californians must either have qualifying health insurance or pay a penalty when filing their state tax return unless they qualify for an exemption. For the tax year 2022, the penalty would cost at least $850 per adult and $425 per dependent child under 18 in your household. A family of 4 with 2 adults and 2 kids who goes uninsured for the whole year will owe at least $2,550. Keep in mind, these penalties may vary from year to year. California also offers low-income and middle-income families financial help with health insurance. There are many different ways to obtain health insurance, including getting health insurance coverage through your employer, through college, or through purchasing private health insurance through an insurance broker. For health coverage obtained through government assistance, there are 3 main categories. The first one is Medicare, which is a free or low-cost health insurance for people 65 and older, or people with disabilities. The second one is Medi-Cal. This is California's Medicaid program, which provides free or low-cost medical services for low-income individuals. The third one is California's Obamacare, which is called Covered California. This is a health insurance marketplace where California residents can purchase private health insurance with financial help from the government. Some community-based organizations in your neighborhood may have certified enrollment counselor that offer free enrollment assistance for Covered California. In this series, we'll primarily be covering Medi-Cal and Covered California. In the U.S. healthcare system, no matter what kind of health insurance you have, you will likely deal with a provider network and a referrals at some point. Your health insurance company is typically contracted with a group of doctors and make them a network for your health plan. And your health plan would typically cover more of the cost when seeing a network provider versus seeing out-of-network providers. And even when you're seeing providers within your network, sometimes depending on the type of insurance, you may need a referral and authorizations from your primary care provider before you're allowed to see another provider, such as a specialist. For example, if you have a health maintenance organization, also known as HMO, you will need to see your primary care provider first and get a referral in order to see a specialist, such as dermatologist for a skin issue. As we mentioned earlier, if you have HMO coverage, you will need to see your family doctor and get referrals to see a specialist. Because of less flexibilities with seeing any specialist whenever you want, the monthly premium cost is typically lower. You're still covered for any emergency medical services you're seeking out of network. For example, you can go to any ER room to receive emergency medical treatment even if the clinic is out of your insurance network. Here's an example. I have a friend named Steven, and Steven wants to see an in-network specialist to treat his acne without having to receive a referral from a family doctor first. And he doesn't want to pay a high monthly premium for health insurance. Which plan type would be the best fit for Steven? Both PPO and EPO do not require a referral from the family doctor to see an in-network specialist, but the EPO typically have a lower monthly premium cost because it has a smaller provider network compared to the PPO. In this case, the best plan choice for Steven is EPO. Another example, my cousin Amy already has an HMO plan and need to see a specialist for her knee pain. Does she need a referral? As we mentioned earlier, if you have HMO coverage, you will need to see your family doctor and give referrals to see a specialist. It's very important to obtain health coverage but also understand what's covered. Coverage level varies by different insurance plans, but typically covers doctor's visit, emergency room visit, maternity and newborn care, mental health services, prescription drugs, lab tests, and free annual physical checkups. Health coverage for minors usually also include dental and vision care as well. Let's review some health insurance key terms. Premium is the monthly cost of your health insurance. A copayment or copay is a predetermined rate that you pay for healthcare services such as a doctor's visit or prescription. Co-insurance is the percentage of cost that you need to pay for covered medical expenses after you have met your deductible. Deductible is the amount that you must pay out of pocket for health services before your plans start contributing. So, when can you apply? Medi-Cal applications are open all year round, so individuals can apply at any time of the year. Covered California open enrollment is usually from November 1st to January 31st of each year, during which everyone can apply. To apply for Covered California outside of this enrollment period, an individual can apply during a special enrollment period, which is within 60 days of experience of a qualifying life event. Here, you can see some examples of qualifying life events that will allow you to enroll outside of the open enrollment period for Covered California. These could be events including, but not limited to, losing your health insurance, having a baby, gaining citizenship or lawful presence, permanently moving to or within California, or getting married.
Lastly, here are some QR codes and links to resources including the Benefits Cal website to apply for Medi-Cal, the Covered California application website, the Covered California Shop and Compare tool, as well as the AJ SoCal Health Access Resources page. Thank you for watching our Health Coverage Enrollment and Utilization educational series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai.